Hello, friends. Very interesting topic is here. Thyroid function test, disorders, and their interpretation. So, thyroid function test is performed to access or to know whether our thyroid gland is okay or not. For this, we have different methods. Ultrasound is there to get picture of gland. Thyroid scan is there to get image by the use of radioactive iodine. Thyroid uptake test is there to measure how well thyroid absorb iodine. And finally, thyroid hormone test T3, T4 and TSH, which we are going to discuss today. These T3 and T4 are actual thyroid hormone which function at cellular level, and TSH is stimulator which cause production of T3 and T4 from thyroid gland. So let's talk why thyroid function test has become routine in health checkup nowadays. Why we are emphasizing so much about these things. Why T3 and T4 are so important. Okay, so it is because they are very crucial for us. These T3 and T4 calibrate our body on daily basis. They are like our calibrator. That means they have influence on all activities of our body, such as sleep, rest, eating, digestion, cellular metabolism, storage, energy balance, heart rate, and many more. So ultimately they maintain basal metabolic rate of human body. Okay, so before going for thyroid testing and disease, we should be aware of this axis or this feedback mechanism of thyroid. Here we can see here hypothalamus pituitary thyroid axis. This is the hypothalamus, this is pituitary, and this is thyroid gland. From hypothalamus, TRH get produced, which comes and function at pituitary gland, and from pituitary TSH is produced, which have got receptor in thyroid gland, and that this TSH comes to the blood and act on thyroid gland for the production of T4 and T3. Okay, so regarding to T4 and T3, the T4 is produced in excess from thyroid gland, but T3 is more potent in function. Okay, and in peripheral tissue and in body, the T4 can be converted to T3, and ultimately T3 is the one which function at cellular level in the body. So after adequate production of T4 and T3, they provide negative feedback to the heart center, to the pituitary and to the hypothalamus. In this way, they get control in the line in our body for adequate performance. Okay, now let's see the testing of thyroid hormone. The sample is blood, and the timing is morning sample is preferred for thyroid test. Why it is so? Because circadian rhythm means day and night cycle, affect the TSH level, which is high in the morning and slightly low in the evening. Okay, so methods for thyroid hormone testings are ELISA, which is enzyme based, FIA, which is fluorescent based, and CLIA, which is chemical reaction light based. Okay, so the CLIA is the most preferred one nowadays in hospital and clinical laboratory. Let's see the pattern of testing. So this is the pattern of testing. The TSH is the number one test. Okay, so in order, we should test the TSH at first. It is the initial screening test for thyroid hormone disorder. If somebody asks you what is the screening test for thyroid hormone or thyroid disorder, you must answer TSH. If TSH is okay, there is no need of further testing. But if TSH is abnormal, we should go for T4. This is number 2 test. And why T4 after TSH? Because TSH and T4 are directly connected. They have logarithmic relation. That means decrease in T4 will significantly increase the TSH in our body. Okay, so they are more related. Number 3 test is T3. Okay, why T3 is needed is to get overall picture or to get overall direction of thyroid disorder. We should also perform T3 later. Okay, other than that, there are other antibodies test such as anti-TPO, TSH receptor, and also the thyroglobulin test are there to find any other problem in thyroid such as autoimmune and other cases. So this is the pattern of test. First TSH, then T4, then T3. Okay, then other autoimmune antibodies and antigen. So this is the diagnostic tree. Okay, here also we can see TSH is at the top. That means first we have to test the TSH. If it is normal, then no further testing. But if it is abnormal, either elevated or decreased, then we go for T4. Here also T4. Then according to the pattern of TSH and T4, we classify the different thyroid disorder. Okay, then we come to the conclusion. We will discuss this pattern one by one. Before that, we should have knowledge about these things to know the pattern of thyroid disorder. Okay, one is hypo, other is hyper. Hypothyroid or hypo means ultimately there will be low T3 and T4, and hyper means ultimately there will be high T3 and T4. Okay, you should also know the primary and secondary term. Primary means 1 degree. That means the problem in neck region, that is thyroid gland. Primary means problem in thyroid gland, and primary can be hypo and hyper. Okay, similarly another term secondary is there, 2 degree. Secondary means problem in head region, that is pituitary or hypothalamus, and secondary also can be hypo and hyper. Okay, secondary also called as central problem. And also the tertiary term is used when there is problem especially hypothalamus. Okay, so you should understand this term to understand the disease. Let's come to the disease. So first one is primary hypothyroidism. Let's go by the name. Primary means problem in neck region, that is thyroid gland. Hypo means less production. So let's go to the primary means problem in this thyroid gland. Okay, this is the pictorial representation of the thyroid axis. This is P means pituitary part, H means hypothalamus 1, and this T and the butterfly shaped, this is thyroid gland. Okay, let's know primary hypo. Primary means problem in thyroid gland. Okay, and hypo means low production of T3 and T4, and this low production will provide feedback to the pituitary, which increase the production of TSH. Okay, so when you see report in lab where T3 T4 low, TSH increase, that is primary hypothyroidism. And the example of disease are Hashimoto disease, cretinism, myxedema, and other iodine deficiency problem are there. Okay, so this is primary hypo. Let's go to the another secondary hypo. Again, secondary means problem in head region, hypo means low production. Okay, so this is pituitary, this is hypothalamus, and this is thyroid gland. So secondary hypo, secondary means problem in this part, pituitary or hypothalamus. Secondary hypo means problem in pituitary, hypo means low production. So from pituitary there is low production of TSH, TSH decrease. When there is low production of TSH, ultimately there is low production of T3 and T4 from thyroid gland, because this TSH is the one which come and act at thyroid gland and which stimulate production of T3 and T4. So from pituitary initially there is low production of TSH, and finally there is low production of T3 and T4 from thyroid gland. So all get decreased. This is the condition of secondary hypo, problem in head region. What can be the cause? Necrosis can be there in head region, in pituitary, trauma can be there, tumor in pituitary can be there which suppress the production of hormones. Okay, there is another condition, primary hyper. Again, primary means problem in neck region, thyroid gland. Hyper means high production. So there is high production of T3 and T4. When T3 and T4 is high, they will provide negative feedback to the higher center. So TSH will be the low. T3 T4 high, TSH low in the report is primary hypothyroidism. The disease are Graves' disease is there, toxic thyroiditis, and other nodular goiter are there. Okay, so another secondary hyper. Now problem in head region, secondary hyper, problem in this head region, pituitary or hypothalamus. Hyper means high production of TSH from there, and ultimately due to the TSH there will be high production of T3 and T4 from the thyroid gland. So all get increased in the report. So when you get report where there is T3 high, T4 high, TSH high, then secondary hyper can be the condition. And what can be the cause? Pituitary tumor can be there, hyperplasia can be there, or sometimes ectopic production of TSH can be there. Now another case, subclinical hypothyroidism. You understand the term subclinical means there is no appearance of symptom clinically. Hypo means hypothyroid disorder. Okay, let's see the picture. So this is thyroid gland, this is pituitary. What happens in subclinical is you will find the report where T3, T4 normal, then TSH increase. So in this case, what happened is that here T3, T4 now it is normal, but when left untreated, it is converted or it may be converted to the overt hypothyroidism or true hypothyroidism later, maybe after a few weeks, month or year. So now it is normal T3, T4, but if left untreated, it get converted to the true hypothyroidism. So that thing our pituitary sense very early, it is very smart. That's why TSH starts producing. Okay, so that's why TSH is high here. So when you get T3, T4 normal and TSH increase, that is the case of subclinical hypo. Similarly, subclinical hyper is there. No clinical symptom of hyperthyroidism. Same here, T3, T4 normal in laboratory report, but TSH is decreased. So that means if left untreated, now T3, T4 is normal, but if left untreated, ultimately they will increase later. Okay, so body senses is very early because pituitary is very smart. That's why it starts producing less TSH, because ultimately after some time they will increase T3 and T4. So this is the report of subclinical hyperthyroidism. Another condition is there, T3 thyrotoxicosis. Here is focus on T3 only. The picture, the laboratory report is that T3 is decreased, TSH decreased, T3 increased, but T4 is normal. Okay, because it is T3 toxicosis, so T3 get increased, and this T3 will provide negative feedback to the higher center. That's why TSH get decreased, but T4 is normal, and this is the case of T3 thyrotoxicosis. What can be the cause is high deiodinase activity. That means this cause the production of more T3 from T4 due to the high deiodinase activity, or it can be seen in early stage of primary hypothyroidism, or in mild iodine deficiency. In mild iodine deficiency, all iodine get diverted towards synthesis of T3, or in case of toxic nodule, this type of picture can be seen. Thyroid resistance syndrome is there. So here thyroid resistance means no thyroid hormone can work at cellular level. Okay, so thyroid gland produce more T3 and T4, and also the TSH is more produced from the body. So in thyroid resistance syndrome, all T3, T4 and TSH get increased. Sometimes TSH is normal. Okay, so in this case, what happened? The T3 and T4 get produced from thyroid gland, but cannot act at cellular level, cannot function at the body. So resistance to the peripheral tissue. What can be the cause? The TH receptor defect. Thyroid hormone receptor defect is there. That's why they cannot function at cellular level. But these patients are normally or clinically euthyroid. Okay, most of the time clinically euthyroid. Why is that? Is because when there is increased production of T3 and T4, and there is also more production of TSH in body to overcome the resistance effect. So more production of thyroid hormone, some of them may act in the body. So that's why they are clinically euthyroid. Okay, but all are increased. But sometimes they also show the mixed type of symptom according to the nature of expressed receptor, either alpha or beta. Which type of receptor are expressed in different part of the body. According to that, in this case, the mixed symptom of hypo and hypothyroidism can also be seen in thyroid resistance syndrome. Okay. Another condition is there, low T3 syndrome, or you can say euthyroid syndrome, or non-thyroid illness is there. So in this case, what happens is that thyroid gland is normal. Okay, that's why non-thyroid illness. Thyroid gland is okay. TSH is also normal. Okay, T4 is normal. But problem is that there is less synthesis of T3 from T4. This step is inhibited in body, because we know that most of the T3 get produced from T4 in body, that is peripheral conversion. But in low T3 syndrome or in those conditions, less T3 is produced from T4 because this step is inhibited. That's why it is called low T3 syndrome. So here TSH and T4 normal, but T3 is low, and also thyroid gland is okay. Then that is the condition of low T3 syndrome. What can be the cause? In case of severe illness, in malnutrition defect or prolonged hospitalization, the metabolism of body gets severely disturbed. And that's why they cause in problem in deiodinase enzyme also, which will inhibit the synthesis of T3 from T4. That's why it is called low T3 syndrome. So friends, that's it for today. If any query and questions, you can put in the comment. Thank you very much.